real quick. Who in the audience feels that they truly understand the complexities of homelessness? Okay. Great. And we have cause study, I know. So what is the #1 cause of homelessness?
Lack of clothes.
Right? Okay, so we all know that. So that's why we're talking about permanent housing. Unfortunately, one of the things that a lot of people do believe in is because of people are lazy, or because they have mental health issues, or because they have medical health issues. Of course, those could be perpetuating factors. I have a little niece, and she asks me what I do, and I tell her I work with the homeless, and she goes, "Oh, that should be easy. There's an answer. You give them a home." Right? So my little, niece understands the need. So I always like to say, with the city of Santa Ana, I kind of work a little bit on the front end of addressing homelessness, and Jensen Brown, who is our housing authority manager, kind of works on the back end, which is permanent housing. Now, of course, permanent supportive housing can be the number one answer. Oftentimes, the reason, as Helen had mentioned, there's a lot of lawsuits that have been happening in Orange County, and last year the city of Santa Ana actually sued 34th and the rest of the county because there was a lack of shelter. That was unprecedented, and the reason that the city did that is because the city truly felt that there was a lack of regional support in addressing the issue. By that I mean that the #1 county-wide shelter is in the city of Santa Ana, and it's right outside my office in City Hall. And there's about 425 folks there experiencing homelessness and sleeping in cots, as Helen mentioned. Obviously, that's not ideal. Emergency shelters are the interim answer, but reality is permanent supportive answer is the permanent. So what we decided to do is we, as a city, gained a lot of political will, and we educated our constituents, and we educated our residents, and we said, you know what, we do understand that there's a lack of regional support, so what we're going to do is we're going to take part of this, this litigation and try to task other cities to create shelters as an immediate response. So with that being said, I'm proud to say a year later, you've got Tustin, Costa Mesa, Orange, and Anaheim, several other cities that are tasked with creating shelters. And the city of Santa Ana actually set the standard. So I'm going to kind of talk a little bit about that. And again, I understand today is not really about shelters, but what is the exciting part is shelters can often lead to people getting to permanent housing as well, with the supportive services needed. So I pulled up our City of Santa Ana website. If we could just go to the Santa Ana homeless fact sheet. Just kind of want to talk to you a little about Santa Ana, because one of the things that we've seen is that many people have landed in Santa Ana from obviously other parts of the county. And unfortunately, one of the reasons that we're pushing back on that is because we want other parts of the county to create infrastructures to address homelessness, whether it's an emergency shelter, whether it's permanent housing, whether it's subsidies for rapid rehousing. So if you scroll down, this is just a little fact about Santa Ana. We have about 781 total shelters, beds. The Courtyard and the Link, which I'll talk about later, which is our newest shelter. Regina House, Hospitality House, Safe Place, a lot of shelter beds there. We hold about 70% of the entire county's shelter bed count. We are highly invested in affordable housing, as Helen knows. We have about 210 permanent supportive housing, 71 units, which the Orchard, the Mercy House is going to be talking about. Aqua Housing in Veterans Village. Veterans Village, which had its grand opening not too long ago. 56 and 75, and 10 at the depot at the Santiago, which is in collaboration with the County of Orange with mental health dollars to address certain units for folks to receive mental health services. We have 1,500 plus affordable housing units, 2,700 Section 8 vouchers. Does anyone know what the Section 8 voucher is? A couple of you guys. So there's two models, right? There's a project base, which means that you actually have a permanent site with permanent supportive housing, and it requires developers and all the infrastructures and everything that Helen knows. And then there's a Section 8, where it's kind of like, I like to call it the golden ticket, which is the subsidy. Now, the thing about Section 8 is I've had many conversations with the National Alliance to End Homelessness and United States Interagency Council. I went to DC this past summer to kind of lobby for homelessness. And one of the things is that you can have this golden ticket called Section 8 where you could go to a landlord, but the reality is there's not enough because vacancy rates are really low. And I love to talk about narratives because I feel like there's power in the story, so I'm going to take a few minutes. As Helen mentioned, I have worked in the county of the county of LA. And the county of LA has had 53,000 people that have been homeless. 53,000. Has anyone here seen Skid Row? Yes. Sure. Skid Row is the epicenter of the nation's homeless population. And you see things there where you just pray. And you see a lot of the churches there, giving food and shelters. But the reality is that when you have such a homeless population, there's mental health, there's medical health, there's all these different kind of barriers. So I worked there and years ago, and I had a certain potential person I was working with that was experiencing homelessness. Actually managed a huge shelter through a church, Catholic Charities actually, and it was 300 women, and it was emergency shelter. We were trying to get into permanent housing, and I had clients that ranged the gamut. I had a 70-year-old woman who, back in her 20s, back in Kentucky somewhere, she was a council member back years ago and landed in this position in life. I had a woman who was battered and abused by her partner and didn't have anywhere to go and ended up homeless. I also had an individual who experienced homelessness and was very intelligent, used to work for Boeing, and just had a divorce and lost everything. So as you all know, it runs the gamut. But I was able to get her a golden ticket, that Section 8. And what had happened was we got her in after a couple of months, found an apartment building. The next day I go into my office, I've got 70 voice messages. Miss Hafsa, I don't know how to open the door. Miss Hafsa, I don't want to sleep in the bed because that's where I remember being raped the last time I had a house. Miss Hafsa, I'm going to slip in the bathroom. And so the reality is, I say that because Section 8 is good, but permanent supportive project-based housing, such as the Orchard and Diamond, really have the efficacy needed to sustain people in self-sufficiency because it's on-site. So that was a little story I had there. Quick and dirty real quick, City of Santa Ana. We also created a draft homeless plan. Elizabeth, if you could just go back to the website real quick. Hope I'm not talking too fast. Okay, thank you. There we go. Okay, so just, we're very transparent. The City of Santa Ana, that's one of our models. And we created a draft homeless plan, which you could peruse later. We don't have to get into that. Needle exchange has been a huge contentious issue in the past year. The County of Orange actually sued a program that was going to start in conjunction with the Department of Public Health. And of course, I know Dr. Snow and the Costa referenced much of the crisis on drug addiction. But we see this out in the streets. And so one of the things that we have is if you go down, we have something called, and if you could click on the emergency shelter. Actually, I'm sorry, if you could go to, the emergency shelter, the link down the dashboard. Great. Before I start talking about this, I just want to let you know what the City of Santa Ana has done in terms of creating an infrastructure to address homelessness. So we get emergency solution grant dollars. That's dollars from HUD. Federal dollars to address either rapid rehousing, prevention, emergency shelter, or outreach. Oftentimes, there's two populations that are out on the street in the middle of the night. And do you know what those populations are? It's a person maybe experiencing homelessness, and then also law enforcement. Those are the two consistent populations. So oftentimes, cities are tasked to address homelessness by calls of service to the police departments. Go to council meetings, you're always gonna hear there's not enough cops, right? There's not enough folks for securing safety. So one of the things that the city of Santa Ana did very strategically is we utilized our emergency solutions grant money, which funds outreach to a program called HEART, Homeless Evaluation Assessment Response Team. And that is a team of officers who actually go and they are tasked with addressing individuals experiencing homelessness. The individuals who may be able to, feel like they have mental or medical issues, and we go with county healthcare agency workers. And that's a really great outreach model because you have safety and then you also have the actual best practices to support the individual experiencing homelessness. That's one of the things we did. The other thing we did was back in March, we went ahead and had a point in time count that was city-led. We planned it at 4 p.m. on Friday before Easter weekend for the Saturday at 4 a.m. And we got 120 staff that came out to go and say, hi, my name is Hafsa. Can I ask you a question? Are you homeless? Can I ask you how you became homeless, et cetera, et cetera. And we found that our population in the city of Santa Ana exponentially grew because of, unfortunately, the riverbed and everything that was happening with that. We found that about 52% of the population came out of Santa Ana. We saw that 39% of the folks self-reported mental health and about 32 self-reported medical health issues. And so we knew that we had a problem. And so with that, we declared a shelter crisis. And we did that primarily because we were also very much supported by the state of California, by the Homeless Emergency Aid Program. Anybody heard of the HEAP dollars? So people who are addressing homelessness, municipalities, local jurisdictions, you go after the federal, you go after the state, and you go after the local. So we have the federal ESG. Now we're looking at our state. So the governor went ahead and released, I think it was about a couple million all throughout the different continuums. And the city of Santa Ana, we were allocated $3.5 million in order to address homelessness for acquisition and improvement in terms of shelter. So what we decided to do is take this courtyard emergency shelter and transition into a more suitable site with the county of Orange and expand our beds. That's very exciting, and that shows true partnership with the county. But what the reality is, again, as Helen mentioned, those are going to be a permanent shelter, not enough housing. So what we also decided to do is, since we knew that we had an exponential amount of folks on the streets, over 1,000 people in the city of Santa Ana that were homeless, we said, okay, we got the shelter crisis, let's go ahead and create a 200-bed shelter. And guess how many days we did it in? 28 days. And we did it with the support of the judge, David Carter, Judge Honorable David Carter, I'm sure you've heard of him. We did it because it was a true private and public partnership, and we did it because we had a strategy of bringing in all of the city interdepartmental teams. We brought in our city's public works, we brought in our parks and rec, we brought in our developer, we brought in our supportive services, and of course we brought in Mercy House. Mercy House was our contracted operator. And so within 28 days, we built this beautiful shelter. Elizabeth, if you could go back to the, and then if you could click down, or actually, read more. And then if you could go all the way down to the link. Up, that link, up. Yep, that blue link right there, yeah. And the reason we called it the link is because it's merely not an emergency shelter. It should link you to the supportive services and to housing. And if you go down, you can, obviously everything that I kind of talked about a little bit here, but if you could click on the picture right there, yep, that. Yep. This is kind of what the link looks like. Right where it says photos, where it says tap to view. And so that's kind of what our shelter looks like. Instead of cots, they're beds, and they humanize individuals experiencing homelessness. And there's ADA bathrooms, and there's ambulatory bathrooms, and it serves 90 men, 60 women, 40 families, and 10 couples. And I am proud to say, since day one, the couple section was completely full. So, and all the family beds are completely full. We had an 8-month-old pregnant woman that was outreached last month. We had a 7-month-old baby that was outreached in the parents. And we are almost at capacity with enough room for attrition, folks going in and out. And as you can see, there's a beautiful mural up on the right over there, right where your arrow is, of the judge. And it says, the harder the battle, the sweeter the victory. And so Mercy House provides employment services, provides referrals to mental health, provides referrals to medical health. The case managers work with the clients on a housing plan to say, okay, what kind of services works with you. One of the things that I was very intentional about is ensuring that this shelter was tapped into the coordinated entry system. Anywhere aware of the coordinated entry system? It's basically the national system to get people matched to housing. I like to call it the match.com, right? So you kind of get to say, hey, you know, I've been a veteran, or, you know, I've had mental health, or I've had medical, and then you get matched to the specific subsidies that goes with that. For example, a VASH voucher can address someone who's a veteran. Perhaps an HSA unit can be matched to a person who's got diagnosable mental health. So we are very intentional about CES, the Coordinated Entry System. And if you go back to that data dashboard, I want to show you guys something. We just surpassed our 100th day at the shelter. And within 100 days, we were able to get 20 people into permanent housing. 20 people into permanent housing in 100 days. There are shelters that are not able to get folks into permanency until 2 years. And I have to thank Mercy House because they did an exceptional job. And if you kind of go back down to the dashboard, one more, back up where we were, that little dashboard. We got folks reunified with their family, and then one more. We got folks into rapid rehousing, which is getting an apartment and providing subsidy. Yeah, the data dashboard. If you go down, right there, the link data dashboard, right now. And we were also able to get about 4 people into the orchard, which the ladies will talk about here. And I hope the infographic shows, but if it doesn't, I encourage you to see it. So far, our total enrollments are like anywhere between 150 to 160. Bed nights are about 140. But essentially, our intention when creating this shelter is connecting people to permanent housing. And so, unfortunately, it's not pulling up here, but if you go back and you look at Addressing Santa Ana, you'll see there's a pie chart that shows successful housing placements. So we want as many people to get into permanent housing. The last thing I'll tell you is that we were very strategic, homeless division and housing division in the city of Santa Ana. We went after a NOFA for mainstream vouchers that HUD pulled out last summer. That gave us 50 Section 8 vouchers pretty much. And what we decided to do is take those 50 and put a local mandate that those folks can be connected to the folks that are in the link, and they obviously must be from Santa Ana. So not only have we now had 20 placements with rapid rehousing, reunification, going into the permanent supportive housing, but what we also have is an additional 50 Section 8 vouchers that will be connected. So what we are creating in Santa Ana is a system of care, street outreach with the police, into the shelter, and then connection into permanent housing. And obviously it's great to get someone immediately permanent housing because that's what Housing First is, but oftentimes people in their chronicity may need the additional engagement that is provided by the emergency shelter. So that concludes my presentation. If you have any questions, I'll take it. Yeah, so one of the things about Section 8, not only in Orange County, but what we have seen in other counties like LA, is that folks will hold on to their voucher because there's just not enough vacancy with landlords. And so what LA did is, especially, they're going with Measure H and Triple H, which I'm sure you've heard, which a ballot passed 2 years ago to create more permanent supportive housing, is landlord incentives. And I know that United Way is working really hard with that, and so that kind of helps create some incentive, but I don't know the exact data.
You know, sorry.
No.
You know, Santa Ana has building requirements for new complex being built.
That would be the housing authority, and I'm sure I could get that information for you. Yeah. Oh, he was asking me if Santa Ana has building requirements for these projects.
What is the waiting list for the link right now?
So there's actually not necessarily a wait list. I'm glad you asked that question. So if someone wants to refer somebody into the link, we do have a criteria because we are holding that regional responsibility for the rest of the cities. For example, Costa Mesa is going to start their shelter, Tustin's going to start theirs, Anaheim. So the referral criteria is that you must have ties to Santa Ana, you must be from Santa Ana, and you must be homeless, obviously. So once that is brought to attention, you could contact Mercy House and they would then connect you. But there isn't a wait list because there's attrition every day. People are getting housed or people are leaving on their own. But as of right now, this emergency shelter does not have a wait list.
You had referenced, this is slightly off the track of the permanent supportive housing and emergency, but you had referenced HUD having money for permanent housing, rapid rehousing, and prevention. For a while, prevention programs fell out of favor because they were hard to implement, people were claiming, and there were issues that a lot of people figured out. I don't know, is that back in the way, or is that coming back around now, prevention programs?
Well, I could definitely speak on some of the work that I did in terms of more programmatic work in LA. Prevention is still important. The reality about prevention is how do you capture prevention, right? How do you really, what are the metrics to get, when is a person going to fall into homelessness? What are the data matrix? And so I think the County of Orange is going to be working on those things because they are the continuum of care. As for the City of Santa Ana, for our ESG dollars, we just provide a few prevention dollars to a couple of our nonprofit agencies. Last question? Okay, last question.
So that you have the building, but then you also have the courtyard, which is transitioning into the larger facility, the 600-bed facility. Not where is it basically, but when is that transition?
Yeah.
And will they be able to walk up like they can right now at the courtyard?
Yeah, so it's important to know that with the courtyard emergency shelter, the operator is the county. So they are going to be doing the RFP process with the buyer. We are simply, in partnership with them because we have 125 beds. And those conversations are going to be happening soon, but it's not going to be until I think another year. But the reality is, to end my presentation here, is that our hope in the City of Santa Ana is anybody who touches an emergency shelter is that they actually get into permanent housing. And that's why we have programs like the Orchard, and this is a great segue for that.
Thank you for the segue.